occur in such situations. There are thousands of cases of acute respiratory infections, around more than 7,000 respiratory infections, mainly among children. There are thousands of cases of diarrhea, acute watery diarrhea, approximately 3,000. Again, particularly happening in children below 5 years. And we all know what sort of risk and danger that sort of disease will bring to children, especially if there is a lack of healthcare services. There are hundreds of cases of scabies and lice, which almost never heard in Palestine and in Gaza, despite the fact of the shortages, despite the fact of the lack of basic infrastructures. There is a report of outbreak of chickenpox, which is now considered as an endemic in Gaza, despite the fact that Palestinian health system in general, but definitely in Gaza, the immunization system is one of the best here in the region. So there is huge risk of spreading infections that will definitely threaten the public health. The first top, out of these 5 is we call all, conflicting hostile parties to stop ceasefire. We ask everyone to secure safety of the civilians. Number 2, secure safety of the healthcare facilities and those people working in these healthcare facilities, as well as the patients and their relatives, as well as those who are sheltering in the healthcare facilities. Number 3, make sure that we provide continuous, uninterrupted, sustainable supplies of basic essential life needs like water, food, fuel, as well as medical supplies, non-stop, all the time, with no interruption at all. People there are really very much suffering. The suffering is beyond our imaginations. Hospitals are reaching 150% beyond their capacity. In addition to the shortage of supplies, medical supplies and water. Because of the shortage of fuel, some hospitals, in fact, started closing their services. There are around 1,000 people who are depending on renal dialysis. They will lose that sort of service. And some of them have lost that service, in fact, due to unavailability of fuel. There are around 130 neonates, infants, under incubators. There is a similar number under ICUs. There is around 52,000 pregnant ladies. 5.5 thousand are expected to deliver next month, with around 180 deliveries a day. They are going to lose that sort of service because of lack of fuel.